Right. Welcome, everybody, to our Research Week webinar. My name is Melissa Ennis, and I am the Communications Advisor for Quality of Care. Before we get started, I just want to let you know that the chat box and the Q&A feature are both open, so you can feel free to use them throughout our presentation today. You can also turn on subtitles, which are auto-generated by clicking the CC button on the bottom corner of your screen. And I just would like to let everybody know that our session is being recorded today so that we can share it via our YouTube channel a little bit later. I'd like to start with an acknowledgement that the lands on which Memorial University's campuses are situated are in the traditional territories of diverse Indigenous groups, and we acknowledge with respect the diverse histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. We invite everyone to offer land or territorial acknowledgements in the chat and to take a moment to reflect not only on why we offer these acknowledgements, but also ways your life and work may contribute to decolonization and reconciliation. For those who aren't familiar with Quality of Care NL, we're a research and evaluation program based at Memorial University, aimed at improving social and health outcomes in our province. We're part of the NL Support Unit, which is a group dedicated to advancing patient-oriented research in the province. Today, we are excited to present some data we've been reviewing on the social determinants of health in Newfoundland and Labrador. We're joined by some members of the Quality of Care NL team. Kathleen Mather is a health policy analyst for Quality of Care. And she's also joined by Susan Stuckless, one of our research associates, and Quality of Care NL manager, Robert Wilson. If you have any questions throughout the presentation, please feel free to type them in the chat or the Q&A box, and hopefully we'll have time to cover them all at the end. I'm going to pass it over now to Robert and Kathleen to get us started.
Thanks, Melissa. So we're really excited to be able to present on some new work that Quality of Care NL has been doing on the social determinants of health. So like Melissa mentioned, I'm Kathleen Mather, a health policy analyst with Quality of Care, and I'll be presenting our information today. But my colleague, Dr. Susan Stuckless, who's done a lot of the data analysis, is also here today to help with any questions that might come up. So I'm going to progress us on to our next slide, and I'm going to pass these slides over to Dr. Robert Wilson, who's the manager of Quality of Care. He's going to provide a little bit of additional context about us and what we do.
Hi, everyone. Just before I pass it over back to Kathleen to kind of dive deep into the social determinants of health data that Susan and herself had been analyzing, I just want to give a bit of context of who Quality of Care NL are for those who are unfamiliar with our program. So we are an applied health and social systems research and evaluation program aimed at improving social and health outcomes in Newfoundland and Labrador. And we have a collaborative effort between the leading health care entities in the province, and our goal is to improve the quality of care by facilitating change to ensure the right treatment and services, now that we're kind of diving into the social determinants of health, gets to the right patient and person at the right time. So we also kind of have a partnership with Choosing Wisely Canada, and we have our regional hub called Choosing Wisely NL. And those who are unfamiliar with Choosing Wisely Canada, it's basically a national initiative to reduce unnecessary treatments and tests in the healthcare system. And Quality of Care also leads the learning health system component of NL Support. So NL Support is one of 11 support units across Canada under the strategy for patient-oriented research. So we move on to the next slide, Kathleen. So this kind of just gives a definition of what a learning health and social system is. Quality of Care NL operates on the principles of a learning health and social system, one that continuously improves through a culture of best practice evaluation, equity, openness, and collaboration. So the system constantly learns and gets better, resulting in better care and health for all. And underneath that definition is something that was a definition that came straight from the Health Accord. And the concept of a learning health and social system is not one that is new. A learning health system, the idea and concept has been around for many years, but the idea of expanding that idea and framework to the social system is pretty novel, and we are kind of one of probably the leading entity, maybe across the globe, that is kind of incorporating this concept. So from the definition of the Health Accord, we get a learning, health, and social system is one in which science, education, informatics, incentives, and culture are aligned for continuous improvement, innovation, and equity. Best practices are seamlessly embedded in the delivery process, and individuals and families are active participants in all elements, and new knowledge is generated as an integral byproduct. So as you with the public or researchers taking part in a session like this, you are actually contributing to a learning, health, and social system. So if we go on to the next slide, Kathleen. This just kind of gives an image of the framework of a learning, health, and social system. I won't go into great detail of what this is, but on the bottom is core values, and across and connected and aligned with those core values are the pillars which make up a learning, health, and social system, which includes social, scientific, technology, policy, legal, and ethical values. In the middle, you see a learning, health, and social system process, or other kind of buzzwords or terms used for this is learning cycles, where basically you take data, you turn that data into knowledge, and you take that knowledge and you put it into practice, and the cycle continues and continues until it's constantly trying to improve itself. And in the middle of those learning cycles are the problem or the research question of interest, and involved within those learning cycles is a community of learning. And the community of learning includes everyone, from patients and public to frontline workers, researchers, policymakers, all stakeholders that would be involved within the health and social system. And on the top is the outcomes in which the social learning, health, and social system are trying to achieve for patient experience, provider experience, value, population health, and of course, healthcare costs. Another name for this is called the quintuple aim. And this is what we are kind of basing the initiative and framework for learning, health, and social system off. So without further ado, I'm going to pass it over to Kathleen, who's actually going to dive deep into some of the work that Quality of Care has done on the social determinants of health.
Thanks, Robert. So we'll start here with what are the social determinants of health. So the recommendations in the final reports of Health Accord NL that were released in 2022 align with that agenda of Quality of Care NL that Robert mentioned. So we've begun to integrate the social determinants of health into our work in accordance with that agenda. So to improve social and health outcomes, we must make a difference in the factors which have the greatest influence. And our goal with collecting these data on the social determinants of health is to determine baseline metrics available with the intent to monitor them over time. So by tracking these metrics, we can assess if initiatives designed to improve the social determinants of health are having the desired impact. And it will also identify areas where relevant data are lacking and need to be prioritized for collection. So at present, we've used publicly available data from Statistics Canada, the Newfoundland and Labrador Statistics Agency, and other government departments. And we're currently working on a web page to house the data so that it can be shared outside of our unit. So to provide a little bit of background to the social determinants of health, our health is influenced by where we are born, grow, work, live, and age, and also by the wider set of forces and systems shaping the conditions of daily life. And these forces and systems include economic policies and systems, development agendas, social norms and policies, and political systems. And so these social and economic and environmental factors are known as the social determinants of health, and they have a greater impact on our health and well-being than the health system or our genetic makeup and biology. And you can see some of those social determinants of health listed there on the slide. So despite the importance of the social determinants of health on our health and well-being, there continues to be a focus on health system spending in an effort to improve health outcomes. So in this province, this is demonstrated by the comparison of health system and social spending over time. So since 1981, there's been a 6% increase in social spending and a 232% increase in health spending. And despite this investment in the healthcare system, and in fact, the province has the highest level of per capita spending on healthcare, we have the poorest health system performance among the Canadian provinces. So compared to the other provinces, Newfoundland and Labrador has a higher rate of deaths from cancer, cardiac disease, and stroke, the lowest life expectancy, the highest proportion of older people with 3 or more chronic diseases, and the highest level of complex health needs among children. So this graphic just kind of shows what I was talking about. So we've got the breakdown of the impact of the social determinants of health on our health and well-being. So we've got this 50% plus 10% are the social determinants of health. So that's 60% compared to 25% from the health system and about 15% from our genetic makeup and biology. So we can see that the social determinants of health are a very significant factor. So here we've just listed the broad categories we've collected data on to date. And given the time that we have for our presentation today, we're only going to present on the data that we have on poverty and the related subcategories. And within some of these areas, we've also started looking at the data broken down by different equity-seeking groups where those data are available. And Melissa had mentioned that she was hoping we would have time for questions at the end. We have allocated time for questions and discussion at the end of the presentation. So please feel very welcome to post your thoughts, comments, and questions into the chat or the Q&A so that we can work through them after we finish the presentation. So like I said, the first broad section we focused on is poverty. And within this section, we looked at data on income, housing, and food security. Income is a significant social determinant of health, and research has shown that more equal income distribution is a very good predictor of a society's overall health. So we thought it might be fitting to start this section with the recently released poverty report card from Food Banks Canada. So they evaluated each province on 4 categories related to poverty: the experience of poverty, measures of poverty, standard of living, and the progress on passing anti-poverty legislation. So within each of these categories, provinces were given a grade from A to F, and the average score across the country was D, which they state is to acknowledge that all provinces are doing fairly poorly with regard to poverty. So the province of Newfoundland and Labrador received a failing grade on the specific indicators of government support, stating that rates are insufficient to keep up with the cost of living. The percent of income spent on fixed costs beyond housing, so that's things like utilities and transportation, the unemployment and food insecurity rates, an inadequate standard of living, and passing of anti-poverty legislation. So the report notes that the percent of the population receiving EI is over double the national average, and it highlights that the province has the worst unemployment rate in the country at 10%. They note that almost 50% of people in the province struggle to access fresh and affordable food, which is an interesting fact when we look at the rates of fruit and vegetable intake in our province. And they mentioned that the proportion of income that households in Newfoundland and Labrador with low incomes are paying towards fixed costs for elements like utilities and transport are among the highest in the country. And in terms of social assistance, they note that 1 in 5 people are receiving social assistance from the province, and that social assistance rates in Newfoundland and Labrador provide an amount that is less than half of the poverty line for a single working age adult. So this report just kind of provides a nice overview of the various poverty-related factors that we're going to individually highlight in the coming slides here. So in terms of income, we see that compared to the Canadian average, Newfoundland and Labrador has a lower gross income. And as I mentioned on the last slide, it depends more on government transfers for income compared to the Canadian average. So while the poverty report card highlighted the higher rates of employment insurance payments in Newfoundland and Labrador compared to the Canadian average, other transfers include old age security and workers' compensation. So now if we further break down available income information to look at several equity-seeking groups, we see that while the incomes have on average increased from 2016 to 2021 for all groups, the equity-seeking groups tend to be lower than the population average. And I just want to highlight here that we see here that the persons with disabilities data refers to the Atlantic provinces, as data for only Newfoundland and Labrador are not available. So for 2021, the average income for the province was $33,300, while the average for individuals identifying as Indigenous was $32,800. It was $33,800 for immigrants, so that's actually higher than the population average. And we actually see that this group tends to be close to or higher than the population average over the years. But for visible minorities, the average was $32,100, and the Atlantic average for persons with disabilities is the lowest at $28,800. So we also looked at the market basket measure, which is considered the official measure of poverty in Canada. And the market basket measure is based on the cost of a specific basket of goods and services that includes food, clothing, shelter, transportation, and other necessities that represent a modest basic standard of living And we see that there's been a shift in the prevalence of low income for Newfoundland and Labrador compared to the Canadian average. So we see here that since 2018, the Newfoundland and Labrador average has been higher than the Canadian average. And we do see low income prevalence dropping across the country, with a significant drop in 2020 that has not been fully sustained in the 2021 data. And in 2021, Newfoundland and Labrador ranked 6th among the provinces for prevalence of low income. And again, if we take the market basket measure data and further stratify it, we see that there are differences when we look at gender and age groupings. Generally speaking, in both Newfoundland and Labrador and Canada, low income is higher for females compared to males. And we also see that gap widening in Newfoundland and Labrador when we compare the prevalence in 2020 to 2021. When we look at age, we see that overall in Newfoundland and Labrador, those over 65 have consistently been at lowest risk of low income, and those under 18 years of age are at the highest risk of low income. And here we look at the market basket measure for those identifying as Indigenous, and we see that in both Newfoundland and Labrador and Canada, individuals identifying as Indigenous tend to have a high prevalence of poverty compared to those who are non-Indigenous. So as with the other market basket measure graphs, we've seen the prevalence decline from 2015 to 2020, but increase again in 2021. And in 2021, the prevalence of low income for those identifying as Indigenous was 11.5% in Newfoundland and Labrador, compared to 7.5% for those identifying as non-Indigenous. So here we look at the market basket measure for several equity-seeking groups using Canadian data, because we don't have specific data for all equity-seeking groups available for Newfoundland and Labrador. So of the included equity-seeking groups, we see that individuals identifying as Indigenous have consistently had the highest prevalence of poverty compared to the total population and other equity-seeking groups. All of the equity-seeking groups experience a greater prevalence of poverty compared to the Canadian rate, with immigrants consistently having the lowest prevalence of poverty of the equity-seeking groups. We've also collected data on the Newfoundland and Labrador market basket measure, and this uses income tax data rather than survey data to determine if households or families are in low income. It's based on all tax filers in the province, and therefore provides a more complete picture of low income prevalence in Newfoundland and Labrador. And it also includes extreme low income. So the market basket measure and the Newfoundland and Labrador market basket measure values for the province may differ slightly for each year because of the distinction in the source of data. So looking at the Newfoundland and Labrador market basket measure data, we again see that the prevalence of low income has decreased since 2014. However, we see that there is that 2020 dip. Overall, the proportion of extreme low income has largely remained unchanged. And if we look at an age breakdown, we see here that, again, those age 65 and over are the least likely to experience low income, and those under 18 are the most likely. And here we look at the Newfoundland and Labrador market basket measure by family type. So we see that couple families are the lowest risk of both low income and extreme low income, while lone parent families are at highest risk of low income, and unattached individuals are at highest risk of extreme low income. These data aren't pictured, but we also see that females are more likely to experience low income compared to males. However, extreme low income is fairly similar between males and females. So the Department of Children, Seniors and Social Development, or CSSD, supports individuals, families, and communities in Newfoundland and Labrador in achieving improved health and social well-being and reduced poverty. The department provides financial benefits and other services to eligible individuals with low income to assist in meeting their daily living expenses. And we see here on the slide that there's been a shift in the caseload makeup towards more unattached individuals over time. And we also see that there is significant reliance on the Newfoundland and Labrador Income Supplement, the Newfoundland and Labrador Seniors Benefit, and the Guaranteed Income Supplement. So in terms of housing insecurity is considered the inability to secure safe, adequate, and affordable housing. And it can take a number of forms, including housing cost burden, residential instability, evictions and other forced moves, living with family or friends to share housing costs, overcrowding, living in substandard, poor quality housing, and homelessness. So we're going to discuss two measures related to housing. So core housing need, which refers to individuals living in unsuitable, inadequate, or unaffordable dwellings and who cannot afford alternative housing in the community, as well as acceptable housing, which is if a household meets thresholds for adequacy, suitability, and affordability. And these indicator thresholds for acceptable housing are established by the Canadian Mortgage and Housing Corporation. So the first one we're going to focus on is core housing need, which again refers to living in unsuitable, inadequate, or unaffordable dwellings and where individuals cannot afford alternative housing in the community. So we see here that the rate of core housing need has dropped nationally and in the province. So from 2018 to 2021, the Newfoundland and Labrador rate of core housing need dropped 11.7%. And when we look at core housing need of equity seeking groups compared to the Canadian average, we see that core housing need is higher for individuals identifying as Indigenous, immigrants, or visible minority compared to the Canadian average. And in particular, in 2021, the rate of core housing need was 82% higher for those identifying as Indigenous compared to the Canadian rate. And so the next one is acceptable housing. So again, that refers to if a household meets thresholds for adequacy, suitability, and affordability. And the rate of acceptable housing have increased nationally and in Newfoundland and Labrador from 2018 to 2021. And Newfoundland and Labrador has consistently had a higher rate of acceptable housing compared to the Canadian average. So here, when we look at equity seeking groups, we see that they all have lower levels of acceptable housing compared to the Canadian rate. And acceptable housing rates are lowest for those identifying as a visible minority, with rates being 21% lower for them compared to the Canadian rate in 2021. So then we looked at homelessness. So point in time or PIT counts are counts that measure homelessness in Canadian communities. They collect data on one day and provide a snapshot of individuals experiencing homelessness in shelters, unsheltered locations, and transitional housing, as well as those in health or correctional facilities and those staying with others due to a lack of access to a permanent residence. So we have data from PIT counts done in St. John's in 2016, 2018, and 2022. And I want to note that it's generally well accepted that counts of homelessness underestimate actual numbers. So these PIT counts only looked at St. John's, and they found estimates of approximately 160 to 180 people experiencing homelessness at the time of the count. So when those data were combined using PIT count and the by name list, it's estimated that in 2022, a minimum of 900 people experienced homelessness in St. John's. And the by name list is the community's real-time register of all individuals and families known to be experiencing homelessness in the community. So looking at these data, we see increases in the number of individuals experiencing homelessness and in the number of youth aged 16 to 24 and individuals identifying as LGBTQ2S+ experiencing homelessness. We see a decrease in the number of individuals identifying as Indigenous and little change in the number of individuals identifying as female. So the Newfoundland and Labrador Housing Corporation, or NLHC, offers a number of programs to support individuals and families experiencing housing insecurity. And you can see these programs listed on the table on the slide. We see an increase in the number of clients in almost all of the NLHC programs from 2019 to 2022. And the most substantial increases have been in the Transition House program, the Supportive Living program, and those at risk of or experiencing homelessness assisted by the Supportive Living program. So moving on to food security. Food security is considered the access to nutritious, safe, and culturally appropriate food. Food insecurity refers to the inadequate or insecure access to that type of food due to financial constraints. And food insecurity in Canada is measured through a module of the Canadian Income Survey. And those responses are used to classify households into the 4 categories of food security listed on the slide. So as you can see, household food insecurity is an increasing problem across the country, with every province seeing a higher rate in 2021 compared to 2017, 2018. And they just released a new report on Monday with some 2022 data from the survey that's pictured here. So the rates have continued to increase. So the 2022 data found that the national prevalence of food insecurity rose from 15.9% to 17.8%. And in Newfoundland and Labrador, the prevalence rose from 17.9% to 22.9%. So here we see the breakdown of the different degrees of food insecurity by province. In Newfoundland and Labrador, the overall rate of food insecurity increased by almost 22% from 2017-18 to 2021. And in 2021, this amounted to approximately 90,000 people living in food insecure households. Newfoundland and Labrador also had the 5th highest rate of the provinces for food insecurity among households reliant on social assistance. And then I wanted to just speak to that newer data. So in the 2022 report, like I mentioned, Newfoundland and Labrador had the highest prevalence of food insecurity of the provinces at 22.9%. And these degrees of food insecurity jumped as well. So the prevalence for severely food insecure went to 6.2%. Moderately food insecure went to 9.9%, and marginally food insecure went to 6.8%, which amounts to approximately 116,000 people in the province living in food insecure households. And so when we break down that data further and look at gender, we see that food insecurity prevalence differs by gender in both Canada and Newfoundland and Labrador. So we see that in 2018, the rates were quite similar, but began to diverge in 2019, with the prevalence of food insecurity in females increasing compared to males. So in 2021, the rate of food insecurity in Newfoundland and Labrador females was 22.9%, and in Newfoundland and Labrador males was 22.1%. And if we looked at an age breakdown, we see similarities with low income, where individuals aged 65 and over have the lowest rates of food insecurity, and those under 18 years have the highest rates of food insecurity. However, when we look at that increase from 2020 to 2021, we see that it was the most extreme in the over 65 group, which saw an increase in rates of 68%. And if we look at all groups in 2021, the rate was 17.6% for those over 65, 22.7% for those aged 18 to 64 years, and 28.8% for those under the age of 18. When we look at the equity-seeking groups we have available data for, we see that individuals who identify as Indigenous have a higher rate of food insecurity compared to non-Indigenous in both Canada and Newfoundland and Labrador. However, we see the gap between the two groups is much larger for Canada than for Newfoundland and Labrador. In Canada, individuals identifying as Indigenous had 86% higher rates of food insecurity than non-Indigenous, compared to 25% higher for individuals in Newfoundland and Labrador. We see quite a big jump in the prevalence of food insecurity from 2020 to 2021, with an increase of 36% in that year for those identifying as Indigenous. And like I mentioned, the new data have demonstrated that that rate is continuing to increase. So now if we look at the immigrant status for Canada, we see that immigrants have higher food insecurity rates compared to non-immigrants, and that has increased disproportionately from 2018 to 2021, with rates increasing 24% for immigrants during that time frame, compared to only 3% for non-immigrants. And in 2021, the rate of food insecurity for immigrants in Canada was 21.2%, and for non-immigrants, it was 15.6%. And finally, if we look at visible minority status for Canada, we see that food insecurity rates are also higher for them compared to non-visible minorities. In 2021, the rate of food insecurity for visible minority individuals was 53% higher than those who were not a visible minority. The Newfoundland and Labrador Nutritious Food Basket is a measure that consists of 61 foods from the 2019 Canada's Food Guide. And the prices of specific amounts of these foods, combined with the nutrient needs of individuals and families, determines the cost of the basket. And the basket is calculated based on a family of 4, which is made up of a man and a woman aged 31 to 50 years, a boy aged 14 to 18 years, and a girl aged 4 to 8 years. And it provides estimates for both urban and rural locations in each of the health zones. And in this case, urban is defined as communities with a population of 5,000 and over, and all other areas are defined as rural. So we see that the provincial average cost of the basket has increased from 2016 to 2022. And the average cost for 2022 was $309 per week, with the highest cost on the north coast of Labrador at $467 per week, and the lowest in urban eastern Newfoundland at $274 per week. And based on the reports of food inflation since 2022, we can expect that those costs are likely higher yet now. And so I've just got those, the average and the highest and the lowest rates there circled. So this data comes from the 2022 Food Banks Canada report. From March 2021 to March 2022, Newfoundland and Labrador saw the fourth highest increase in use among the provinces, a 27% increase. And Newfoundland and Labrador also has very high rates of food bank clients that are single parent households, individuals receiving social assistance, and social housing tenants. We also see that over 30% of food bank clients are under 18 years of age, while just under 7% are seniors. And the survey responses found that the top 3 reasons people were accessing a food bank in March of 2022 were the cost of food, low provincial social assistance rates, and housing costs. So to summarize, like the initial overview from the poverty report card, we thought we might end with a snapshot of everything we've covered today related to poverty. So the various categories that we've covered are along the left side here. And the different groups that we compared are across the top. So here I've highlighted how the overall Newfoundland and Labrador rate compares to the Canadian rate for each category. And red means that Newfoundland and Labrador is worse off, and green means that it's better. So we see that Newfoundland and Labrador has a lower rate of core housing need and a higher rate of individuals living in acceptable housing compared to the Canadian rates. And in terms of income, Newfoundland and Labrador is lower than the Canadian rate. And we see that the market basket measure rate is above the Canadian rate, indicating a greater prevalence of low income in the province. And food insecurity, which is generally considered to be tied to income, we see that that's higher in Newfoundland and Labrador compared to the Canadian average. So if we look at the comparison of certain groups in Newfoundland and Labrador, I haven't highlighted where the equity seeking groups compare to the overall Newfoundland and Labrador rate, because in every category, equity seeking groups are worse off compared to the provincial average on all of the metrics that we've included. It is worth noting that direct comparisons aren't possible for those metrics where it's been indicated that the data is from the Atlantic provinces or Canada-wide. I did circle the immigrant food insecurity rate because it's lower than the Newfoundland and Labrador rate, but it's important to note here that this is a Canadian value and it is still higher than the Canadian rate. And finally, we've got a number of blank spaces here on the screen, and those indicate where we have data gaps and are unable to make comparisons or measure change over time. So to wrap up, we provided you with an overview of what we've collected within the poverty bucket of the social determinants of health. But as you can see on the slide, there are many additional categories of data that also fall under the social determinants of health that we didn't cover today. So when we have our webpage fully up and running, data for all of these categories will be available. And so like I mentioned, we've left a good chunk of time here to take some questions and discuss our work in this area. And we're particularly interested if anybody in the audience is doing relevant work in this area. We'd love to hear about it. So I'm going to stop sharing my screen now so we can see folks.
Thank you, Kathleen. Yeah, that certainly was a lot of data to get through. And as we saw from that last slide, only just one aspect of the social determinants of health data that the team at Quality of Care NL is looking at. So now we have some time for questions. I'll ask anybody to type in the chat if they have some questions that they'd like our presenters to answer. I'm going to start with a few that are in there already. Just to get this one out of the way, we'll be able to share the slides with participants. This webinar recording will be available on our YouTube channel, so you can go back and rewatch. And as Kathleen mentioned just a few seconds ago, Quality of Care is working on a webpage on our website where we hope to be able to share a lot of this data analysis that we're conducting from all the aspects of the social determinants of health with the data that is available to us. So there will be other ways to view it for sure. Going back to some questions from Robin, who is collecting the data? So I know Kathleen kind of went through that a little bit where some of our data sources are, but maybe Kathleen and or Susan, you could touch on where we're gathering up this data from, because Quality of Care is not actually collecting any data ourselves. We are analyzing what is publicly available out there. So if you guys, maybe you could talk a little bit about where that data is coming from and what gaps exist.
Yeah, did you want to take that, Susan, or do you want?
I could just, I guess, go ahead here. Yeah, we we chose to look, I guess, at publicly available data. So that would be like Kathleen had mentioned at the beginning of the presentation, Stats Canada, the Newfoundland Stats Agency from Community Accounts, or with the Newfoundland and Labrador Housing Corporation, for example, it was publicly available annual reports or that type of thing. So that's where our data sources have been. And I guess one of the reasons behind choosing to go that route right now, well, one, we wanted to make sure we had data that can be monitored for one, not something that's going to be a one-off situation that a group has put out, because we want to be able to get indicators that the plan is to, that will be continued and standardized across the different provinces and that type of thing. And I think I saw Pablo maybe had mentioned about are there national standards? Well, I guess that's kind of where this comes in. This is going to be a standardized data collection that Stats Canada puts out. So you would assume it will be standardized for all provinces in the way it's collected. And we are basing some of the indicators that we're looking at off of Canada's Quality of Life Framework, which has numerous indicators within there to look at the well-being of Canadians, something that they're working on as well. So I'm not sure if that quite answers the question or not, but Kathleen, if you got anything else to add, you can.
I think the only thing I would add to what Susan mentioned, just around, are there specific standards to collecting the social determinants of health data. So like Susan mentioned, we're using it from data sources that are routinely collected. So like I mentioned, the food security data comes from the Canadian Income Survey that's collected every year. Sometimes those surveys change over time. So like some of the food security data changed from the Canadian Community Health Survey to the Canadian Income Survey at a particular year. And so that makes it difficult to go back beyond when that change happened to compare data. So our hope is that our sources of data will remain the same, so that we can continue to compare like to like. But we're hoping, like Susan mentioned, by using these national publicly available sources, that's our best bet for having comparable data, so we can measure that change over time.
I'd add on to that too as well, on top of the public facing data that is available. Susan and Kathleen hosted a series of town halls that engaged with nonprofit organizations and the community sector. And at the end of those, which they presented this data that you saw today, but at the end of those sessions, they actually tried to engage with those sectors to see whether or not some of these actual organizations were collecting information on themselves, and whether they'd be interested in making a sort of a public facing or availing quality of care to use us for knowledge translation methods.
Yeah, so from our perspective as quality of care, while we're not collecting the data, we are making plenty of efforts to find what is available out there locally, provincially, nationally, and identify where those gaps may be and whether there's opportunity for somebody, the right appropriate organization, to be able to collect that data and hopefully fill in some of the gaps, because it is a really important area of evaluation for our health and social care that isn't necessarily given the same level of it, or hasn't necessarily been given the same level of analysis over the years. Let me just while we're talking about data collection, Robert, I wondered if you maybe could fill us in, because we're analyzing this publicly available data. What would we plan to do with it as we're analyzing it? And we've already outlined our plans to make it available to the public via our webpage. But can you touch a little bit more on anything else we plan to do with that data?
Sure. Perhaps probably the biggest thing I'll mention is our biggest knowledge translation tool, and those who aren't familiar with it, we have a biannual publication called Practice Points, and this kind of showcases a lot of the projects and evaluation that Quality of Care, Choosing Wisely, and Support do, and then there's some engagement with our colleagues, partners across the province who are engaged with the health and social system, along with funding recipients for NL support. But since post-health accord, where they focus so much on the social determinants of health, we decided to dedicate an entire section to the social determinants of health. So perhaps if those who are unfamiliar, Melissa, would you be able to kind of pop the latest volume 10? in the chat room so people could perhaps get a little look at what I'm talking about. And of course, moving forward in each volume, Susan and Kathleen will kind of showcase some high level and focus in on certain topics within the social determinants of health. So that will be our biggest knowledge translation tool and messaging for the public and stakeholders.
And we do share this information with decision makers and provincial government groups like the NL Health Services, the Provincial Health Authority, in hopes that they are able to use that to help with decision making when it comes to healthcare service providing. Looking at some other questions here now, can we link Newfoundland and Labrador social determinants of health data to other databases, for example, Canada Cancer Register? So
right now, with the data that we're using from Stats Canada and stuff like that, we can't link it. We don't have an individual identifier to specifically link it back to like the cancer registry, say, or something like that. But our hope is on a go forward, there can be an evaluation of the community care teams that are going to be in place, because some of their, I guess one of their things will be their intake form, which will collect some of this on a higher level, some of the social determinants of health data, so that we can then hopefully link it to hospital admissions, ER visits, cancer registries, whatever you might want to kind of look at. And I guess one of the other benefits, if that works as well, will be to be able to look at more specific areas of the province to see where differences might exist. Because right now we're looking at this is aggregate level data. It's not individual specific level data. So we're looking at Newfoundland as a whole pretty much. Some of it maybe in Stats Canada can be broken down a little further, but most of the data we have right now is an aggregate level for the province. So that's kind of where we are right now. The hope is to be able to do that. Yes, we can't right now what we have.
for sure. Doug has a question. Oh,
Sorry,
go ahead,
Simone,
Kathleen.
I might just add to what Susan was saying. I think the other piece that is really exciting from my perspective as a possibility of that linking data, like Susan alluded to, if we can see where, say, a particular family care team is noticing that maybe one social determinant, maybe food security is really problematic in their area, then that having that data and having that linked data allows the community care team, or the family care team, sorry, to maybe place more resources around that specific concern. So, you know, if we're seeing maybe in Central, there's a significant problem in this one area, then having the data allows the team to change what they're doing to try to really address that issue that's been identified. So it provides a lot of opportunity, I guess, to tweak what's being done.
For sure. Doug has referenced back to the slide where you showed that graphic, what makes Canadians sick. And in the category of your life, there isn't the level of physical activity or diet. And he asked, should those variables be included? So I'm not, Kathleen, can you recall where that graphic came from?
That graphic was very hard to source because it's been resourced by a bunch of different places. So it was a bit of a nightmare, but I believe it came from the Canadian Medical Association when we went back far enough. But I just opened the slide on my screen, Doug, to verify. And so it does have safe and nutritious food listed. So I would say that would be kind of what they would consider diet to be part of. And then I would say, because infrastructure is under environment. And so if we think about like the walkability of your city kind of relates to the infrastructure. So I think some of those variables are in there. They're just hidden and maybe not under what would jump out to us as what that is saying.
I guess it's a bit of a gray area too, Doug, in the fact that, you know, this is where the social determinants come into play, and the fact that not all people have means to have a balanced and healthy diet, and not all people have the means and ways to have, you know, a good physical activity regimen.
Right. Yeah, it kind of drives that home a little bit that this level, the social determinants of health really do impact that for many people in Canada and all over the world. All right. I'm not seeing any other questions there right now, but I would definitely encourage people if you have any, oh, I will just bring in this comment though from Robin, who wanted to mention that they're looking at setting up a community of practice to explore what a collaborative urban clinic would look like if they follow recommendations from the health accord by prioritizing the social determinants of health. That would be specifically in their neighborhood of Tessier Park by using participatory research methodology. So thanks, Robin, for sharing that with us. It's really interesting to see, what other people are doing on the ground to impact the social determinants of health and learn more about how they're really impacting the health of people in this province for sure.
I might just plug here, Robin, with what you're working on setting up. If that sounds, if you're not familiar, NALCAR, the Newfoundland and Labrador Center for Applied Health Research, convenes a pile of different what they call research exchange groups on all different topics, and they bring together a whole bunch of researchers and academics and people in the public, clinicians, all kinds of people who are interested in a topic to discuss that particular topic. And so it might be, if that's not something you're familiar with, that might be a group to just go and look and see if there's a research exchange group that's relevant to this. And that might be a great way to present some of what you're looking to do, maybe collect some more people for your community of practice, see what sort of linkages there might be there, because those research exchange groups are a fantastic resource.
One more question. Do you think it's possible to explore a better approach to data like they have or had in 2019 in New Brunswick through the Institute for Research and Data? Susan, I don't know if you're familiar with that particular group from out of New Brunswick.
I don't know.
One to perhaps check out then for us to see how they're doing that data collection.
Sure, and perhaps Robin can reach out and just maybe elaborate on what she means by exploring a better approach to data.
Yeah, for sure. I'm just going to pop our general email address in the chat. So if anybody has anything after the fact that they'd like to share or questions or anything like that, you can feel free to reach out to us anytime. And I did put the link to the research exchange groups from the NLCAR group in the chat as well. Just going down through, so Allison had commented that I'm struggling to see how health services can address issues of poverty beyond advocacy, signing people up for the disability tax credit, and our civic role as a voter. Yeah, I think a lot of us would probably struggle with how can you actually change these huge social issues that really impact people's health. And I don't know the answer to that. I don't know if anybody else wants to venture an answer to that, but I think it's collectively, as a society, we have to work together to make those changes. And that's a lot where our governments come in and policymakers and decision makers. I'll throw it over to the rest of the panel if they have anything they want to add there on that kind of somewhat philosophical question.
I mean, I think one thing that we've seen when we look at what's being done elsewhere in the country, so there's some teams in Ontario that have kind of taken this on. They're collecting social determinants of health data. They're looking to see what they can do to support their patient base in terms of that. And so kind of like you mentioned with the disability tax credit, a couple of them actually have what you would consider not healthcare providers at all on the team. And so they'll link people. So if you haven't filed your taxes, you aren't able to avail of all of these different tax benefits that may be available to you. So if it's figured out that you haven't been filing your taxes, then they'll connect you with somebody to assist you with that. And so they have somebody on the team who will assist you with that. And so it's basically just finding ways for people to access all the money that they should have access to help with their financial situation. So that's just one little thing that kind of comes to mind in terms of healthcare not really feeling like healthcare anymore, but looking to improve those social determinants of health.
Sure, and I'd add on top of that to Alison, I'd recommend perhaps looking at the health accord blueprints, because they did such a focus on the social determinants of health. They're trying to link the social system and the healthcare system together, because they I can't say they rely on one another, but there's a lot of overlap within that, right? So look at the blueprints and see what sort of recommendations are coming, and how the social system and issues such as poverty can be addressed within the healthcare system.
But I don't think it's a one thing is going to fix all this. There's so many different aspects, and trying to bring together all the different siloed groups and situations and organizations and stuff that are out there, right? It's also not going to be fixed by next year. As the health authority even said, at least a 10-year plan. So, you know, this is why we're going to try to monitor some of this over time as we go, hoping that as new, I guess, or not necessarily interventions or recommendations, but policies or different things come into play, that they'll have changes in some of the markers that we're looking at, because we can bring in a bunch of different things, but if we don't change the needle on a lot of these indicators, then, you know, what's the point of them? So this is where monitoring over time and making sure that we have standardized indicators to look at will be important.
For sure.
I think here as well, I was just trying to remember what the name of it is, the well-being networks that the government is trying to put in place. I think those will be an avenue for some of that advocacy work. So, you know, in a particular area, we've got all of these different organizations coming together to figure out what the problems are in your area. And so maybe poverty is a really big challenge. So what are all these different organizations able to do together to try to, you know, move the needle a little bit on that poverty piece?
For sure. And there are a lot of great organizations out there doing a lot of work in this area in different smaller aspects of the overall social determinants of health umbrella. One more comment from Doug that I'll just share with you guys because it might be helpful. He says you have to be careful in comparing the adjusted income of Newfoundlanders and Labradorians with Canadian levels. We do not consider differences in the cost of living amongst jurisdictions. So I know cost of living has definitely been a big topic of conversation as of late all across Canada. So is there any indication of how that might impact what some of these numbers look like and when you're comparing from province to province?
Well, we haven't actually done any kind of, I guess, regression type of analysis or adjusted for things, but there are indicators out there that we've also looked at, which weren't included here, like financial well-being, which doesn't necessarily take account of income, but it looks at how people are finding it to pay for the necessities of life right now, and how that financial burden is becoming increasingly difficult. So we have some of those indicators along with some of these that we're looking at but weren't presented today. And I think Doug also mentioned something about the quality of life hub, and that's what I'm referring to as quality of life frame. I'm assuming it's the same thing he's talking about there. It's the quality of life framework, which we have used in some of our work and some of my work that I've been working with the health transformation team. That's where we're basing a lot of these indicators from data sources.
And correct me if I'm wrong, Kathleen and Susan, do the food baskets, I mean, it's only one aspect, do the food baskets incorporate that sort of aspect by province?
Yeah, so I was going to say, I think the market basket measure would be looking, and I might be wrong on this, but the market basket measure looks at a bunch of different components needed to kind of have a basic standard of living. And so my assumption would be that when you're looking at province to province, they would be looking at the cost of those things per province. So then if you're doing really poorly on the market basket measure in Newfoundland and Labrador, then that would be based on the cost of those things in this province. So yeah, maybe housing is lower cost, but maybe food is more expensive. And then if you're looking in Manitoba, maybe you know, housing's more expensive, but food's cheaper. So I think using some of these other metrics other than just income, because you're right, I think just looking at one metric, which is why we've got so many, doesn't give you the whole picture. So if we look at all of these different measures, then that helps to give us kind of a broader sense of what's actually going on.
Sure. Okay, I'm not seeing any other questions in the chat. Some good conversations happening in there though, so that's great. I'm glad we could provide a platform to connect a few people who are doing some similar work in different areas of the province. And if we can help facilitate a connection after the fact, you can certainly reach out to us. But I think we'll probably clue up there for the time. We're about 5 minutes ahead of our end time, so I think we did pretty good. Obviously, I'm going to thank you, Kathleen, Susan, and Robert for presenting all of this data and for putting the work into gathering it and analyzing it. I think we just had a really good discussion. And I think a lot of people are definitely interested in seeing how this data evolves over time, hopefully in the right directions. I would encourage everybody to follow along with Quality of Care NL, because as we said, we're going to be bringing a lot of this publicly on our website, so which is qualityofcarenl.ca. From there, you can access our social media channels and follow us. You can sign up for our newsletters so you can know when we have some of this launched out publicly. We'd love to have everybody join us in this conversation going forward. Thanks to everybody who signed in online today and participated in our discussion. And just a reminder that the recording of this session is going to be up on our YouTube channel in the coming days. So thank you again to everybody, and I hope everybody has a great rest of their day.
Thank you.